In a corner full of stories with a gentle, caring light, Paula is the voice that invites you to take flight. We'll talk of little smiles, tender touches, and sweet care. A show for moms and dads, a cozy space to share. No place is named, just a world of gentle play, where Paula guides you warmly to learn along the way.
Hello everybody. Welcome back to our streaming breastfeeding support group streaming live. This is a very special day today because we're gonna talk about a pretty hot topic, which is antenatal expression of breast milk. Are we interfering with nature? So before I start, I'm going to introduce myself one more time. My name is Paula Laria. I'm an international board-certified lactation consultant. I'm a nutritionist from Argentina. I have a certification in infant massage. I'm a student of craniosacral therapy, and I keep studying every single day to see if I can do something new for my patients. Today, I have a very special guest. It's a wonderful professional lactation consultant. Her name is Mina Ognjanovic-jasovic. Mina has a master in healthcare administration. She's an international board-certified lactation consultant with more than 17 years of experience specializing in neonatal intensive care and high-risk maternal infant populations. She practices across leading academic and community settings in Los Angeles, including UCLA Health Ronald Reagan Medical Center, Providence Cedars-Sinai Tersana Medical Center, and Balboa Pediatrics Encino. Mina is recognized leader in baby-friendly implementation, quality improvement, and systems-level lactation care. She has served as a project manager for the CHAMPS National Program Community and Hospital Advancing Maternity Practice, contributed to multidisciplinary policy development in donor milk and breastfeeding equipment, and has been a long-standing member of UCLA's Breastfeeding Task Force. She is the author of How Los Angeles Families Can Find Trustworthy Breastfeeding and Lactation Support. She wrote that in 2025, which examines inequities, misinformation, and the growing commercialization of lactation care. Her peer review work includes the commentary antenatal colostrum expression. Are we interfering with nature? That's what we're going to talk today. Published in the International Breastfeeding Journal in 2025, as well as Flange Feed in the Real World, a NICU clinician's perspective on pumping and research. Her work centers on patient advocacy, evidence-based lactation care, professional accountability, and the responsible use of emerging practices in maternal child health. Mina regularly presents at local, national, and international conferences and has mentored UCSD Pathway to IBCLC interns for over a decade. She holds a Master of Healthcare Administration from UCLA Fielding School of Public Health and is passionate about advancing equity in maternal child health and creating a structured, ethical professional advancement pathway for IBCLCs. Today, you have two lactation consultants together to answer your questions. Welcome, Mina.
Thank you for having me. Paula is a friend and a colleague, and we know each other for almost 2 decades.
It's crazy. I can't believe it. You believe it?
I know, no. we worked together, and we now work again.
And now we're working together at Balboa Pediatrics, and one of the most beautiful things that I will treasure in my life forever is that Mina was in my labor and delivery of my first baby, and she was at my side the whole time as a doula, taking care of me and helping me to achieve my goals. And that could be a completely different podcast.
I know, I know. I can't believe that's been so long ago, but yes, it's my pleasure to be here, and thank you for having me.
Thank you, Mina. Thank you for taking the time to be here. So, antenatal expression of breast milk, also known as a colostrum, antenatal colostrum expression, and not necessarily the best way to name it, is also known as a harvesting colostrum.
Yes.
What can you tell me about it? What is it?
So I'll start how I first heard about this and got interested in it. It was one of the first conferences that I attended. I don't know if I ever told you this, but right after we took our first exam, and we became IBCLCs, I was very eager to learn more because I didn't think I knew enough.
2009.
So I attended ILCA conference in San Diego, and one of the lectures was IBCLC from Australia, and it was on the topic of antenatal expression used for moms with type 1 diabetes. So it was a very interesting topic for me because coincidentally, a couple months before that, my daughter was diagnosed with type 1. So for me, it was very meaningful to be present during that presentation, and what I learned, it was mind-blowing. I never heard of this. We didn't learn it in school. I didn't know that anywhere in the world people were doing that. But basically, the presentation was about expressing colostrum for the mothers who had type 1 diabetes, and then they used this colostrum instead of using formula in case the baby's blood sugar was low. So as I was listening to all that, I was like, knowing where I was at the time working at the hospital, I was like, I wish at some point, maybe before my own daughter has a baby, I want us to have this. So I was very hardcore, like a cheerleader of this, and wishing that we can start that applying in United States and in my hospital as well. So when I first found out that it's becoming a trendy thing here, I was part of the team of providers in my hospital to create kind of a policy on how to do it. And so basically, ideally, who are the candidates for the antenatal expression is the mothers who have a risk factors, possibly the ones with gestational diabetes or type 1 diabetes or even type 2 diabetes. So basically, because the babies after they're born, they tend to have unstable blood sugar and they need to be supplemented. So at the time, almost 20 years ago, there was a study published that in case the baby of type 1 mother that's born needs to be supplemented, it is better to get a human milk versus cow milk. And so they were following these children for over 20 years to see if they had higher risk of developing diabetes later on in life. And they found out that yes, there's a small chance of that happening, so giving human milk for the supplementation if the blood sugar is low would be the preferred way. So I was very motivated that that becomes a practice. So basically, high-risk factors include diabetes, or maybe women who had previously had breast reduction or low milk supply or thyroid issues or any kind of hormonal. Those would be the candidates to start antenatal expression.
So So from my understanding, and from what you're telling us right now, it will be a specific population that will be better candidate to do this antenatal expression of breast milk. But why do you think nowadays there is so many people try to do it, even if they don't have any conditions?
Yeah, so more and more it's becoming a trend versus there's actually no evidence that everybody should be doing it, and it's creating a lot different issues, potential issues for unnecessary interventions once the mother brings the express milk, oversupply. I've seen antenatal mastitis already, and I think it's just the social media frenzy of over advertising and pushing and making it as a norm versus just use for specific instances. Also, to the studies that I looked into when I wrote my article, it was interesting to find that there was no apparent effect on early delivery, because we know nipple stimulation can actually bring labor, early labor. So some women are not candidates that have risk factors for preterm delivery or any previous issues with preterm deliveries or but the studies that they looked at risk factors for early delivery if you start antenatal expression are very limited. They only looked at the babies born before. They didn't see that there's a lot of early deliveries. They were born, but they didn't look at the late preterm babies. So there's a lot of babies now that are being born between 36 and 37 weeks. And we know that a lot of these women start antenatal expression around 36 weeks. But the studies didn't consider preterm deliveries under 37 weeks. So I think we should look into that. Maybe those babies would have been bigger if they waited another week to be born, because some of them are born small for gestational age, and then they really need to be supplemented, I think.
So basically what you're thinking, that there is a possibility that this unnecessary antenatal expression of colostrum may promote that early delivery, and we don't know.
We don't know. And so most of the studies don't really show. The other thing that the studies didn't see or show, that it actually increases mother's confidence. It was almost like 50-50, because a lot of people say teaching women hand expression prenatally will build their confidence, but the studies didn't prove that. They actually saw some that actually lost the confidence in their ability to feed because they were practicing hand expression and not getting anything, and therefore already bringing this anxiety and stress after they deliver their baby. So some of them, yes, I feel like hand expression is a hard skill to teach, as you know, like it's not such an easy skill to teach.
Yeah.
So it is a valuable thing. That's why instead of focusing on collecting colostrum, if you're teaching somebody to do it, it should be more addressed as practicing hand expression. And if you get something out of that practice, you collect for if you need it later, instead of putting it as like, let's do hand expression so you can collect something so to have it for later, because what happens if that person is not able to express anything?
Exactly, yeah. So from everything that you're talking, right, this is not for everyone. It will be better if we focus in those parents who really need it, which are usually parents that present a condition, and we think that, or we know that most of the time these babies are at higher risk of having low blood sugars at birth.
Yeah.
So we can supplement with colostrum.
Yes.
Instead of, if it's possible.
Yes.
When it's present, because what Mina was trying to explain too is that antenatal expression of colostrum or breast milk, it doesn't really mean that because you try, you're going to be able to express breast milk. If we explain the process of that activates our body to start producing colostrum, it happens at the moment that after we deliver the baby and we deliver the placenta is the one that makes the changes in our body for our body to know that we need to start producing colostrum for our or secreting colostrum for our babies, right? So it could be absolutely possible that you practice antenatal expression of colostrum and you're not, or breast milk, and you're not able to express any.
Yeah.
Right?
And that should be really important to state and keep in mind, so that if you are not able to express, it doesn't mean that you're gonna fail at breastfeeding and not be able to breastfeed.
Absolutely not.
And that's super important to know.
So when is safe? If let's say that this mom is considered a candidate for expressing breast milk prenatally, when is safe to do it? When is supposed to be starting? Can she start at any time? Can she do it with a pump?
Okay, so I would say before you even think about it, you should talk to your OB first and make sure that you don't have any risk factors for early labor or anything less. And then schedule a prenatal consult with your lactation consultant. If you're having a hard time connecting with one, either ask your OB or contact your insurance. Some insurances cover prenatal consults, so I would reach out to either your OB or your insurance and then schedule that prenatal consult. So the person to support you should be IBCLC, somebody that has experience with this, and then around 36 weeks, typically we recommend starting the antenatal expression of colostrum.
Is there a condition, or is there many conditions that where the pregnant woman is not recommended to do antenatal?
Yes, if you're on bed rest, if you're had a premature delivery before, history of premature babies, any early contractions or anything, any high-risk pregnancies that involves possibly you delivering baby early would not be a good candidate.
Perfect. So now I'm going to explain, if you want to show one of the videos that we have today. In media, there is a lot of misinformation. And there is people that want to share their experiences because they truly think that this is the best way to do it. This is how they did it, and they think this is the best way to do it. So now I'm gonna try to go step by step, explaining you what would be the best way to do hand expression of colostrum, what to expect. And as you can see in this video, this mama is trying to express her colostrum, and you'll see her face
I know.
In pain when she's doing it. And sincerely, when you hand express, you should not feel any pain. Look at her face, poor thing. No, that shouldn't be happening.
I also want to say, like, she appears to be very young, and I can say, I mean, I don't know for sure, that she probably doesn't have any risk factors for having issues with feeding later.
Hopefully, she doesn't have any risk factor and she decided to do it. Look at her dancing, so happy, showing that her expression of breast milk. So when you wanna, if you are a good candidate for it, if you're a candidate for it, or if you decide to do it, because let's say that you're like, I wanna do it. We're going to talk about what happened when you do it and you don't really need it. Okay, we're going to talk about that later.
But at least to know how to do it safely and without causing any pain.
Exactly.
Hand expression is a good skill. So,
it's
and Paula is actually one of the best IBCLC I ever worked with. I know after Paula, if I go to the hospital to see a patient and I know Paula saw the patient, I know I don't have to worry about teaching them hand expression because I am 100% positive she did it.
Everybody learned hand expression with me no matter what.
Yes.
Okay, so before you start hand expressing, what you're going to do is to massage the breast very gentle all around the breast area, and you can go around the breast and all the way under the armpit, because we do have mammary gland all the way under the armpit. And you're gonna do a very, very gentle massage. You can go in circles. You can walk with your fingers from the outside to the center. You can do any movement that feels good and nice, because basically what you're doing is helping your body to release oxytocin. So the contact of your skin in your hand and that nice feeling will help your body to release oxytocin. After that, you're gonna imagine there is a line crossing the nipple and the areola in any direction. Can you see it right there? Right there, there, in any direction you want. And you're gonna position your thumb and your index finger 1.5 inches from the nipple at each side. So these fingers will be aligned in the same direction. You don't wanna put your fingers a little bit farther here, because look, the line is gonna be here. You want for the line to be in between the fingers. Once that you have your fingers positioned properly, you're gonna remember 3 movements. Press toward the chest, compress finger together and release. Press back, compress, release. There is a chance that you need to repeat these 3 movements several times until you can see maybe 1 drop of colostrum. Like, we're not expecting big quantities, big volumes or anything, and we're not even expecting to see anything prenatally. We're actually expecting to see milk colostrum after the baby is born. But let's say that you're working on this. I don't want for you to slide your fingers because you can get hurt, or press harder because you want more.
It should not be painful.
It should not be painful at all. It should be very gentle, and instead of pressing harder or waiting longer time, you're just gonna repeat the 3 movements. And once that you finish in one area, you can go all around the breast and work in the whole area of the areola.
I just also want to say, like, even in a hospital, I've heard patients say, like, when I do it, it doesn't hurt, but when somebody else does it, it hurts. Please make sure you tell that person that it hurts. It should never be painful. No matter who is showing you how to hand express, who is doing it, it should be not painful.
Advocate for yourself.
Yeah.
Right?
Yeah.
You have to be.
And then I can show the,
Yes.
no, you do it and I'll use the staff.
There you go.
So if you do have it, it's really hard to actually collect it from the, so I don't know how you teach to to collect while she's
So if this is your first time,
you need somebody else to do it.
big chances are that you're gonna see the drop of colostrum, you're gonna stop and hold the syringe with 2 hands, right?
Yeah.
And you're gonna do this. Once that you do this several times, what's gonna happen is that you're gonna learn to use the syringe this way.
Yeah.
And move it with your
You can also ask your partner to help. Yes.
Absolutely. Hand expression is a good technique for you and your partner to learn, because in some situations where you don't feel well and you want for your partner to be able to give colostrum or breast milk to your baby, your partner can express the milk for you and give it to your baby while you're resting.
Yes.
Yeah.
Yes.
Right? Mm-hmm. What do you think, Mina?
What do we have next to talk about?
So, what's the normal amount of colostrum to expect? Are we expecting big quantity of colostrum? Look at the video that this mother is showing right here. What do you think about this huge bag of colostrum? Is that real?
That's not realistic, and there is assumption that colostrum is yellow. Therefore, if this is yellow, it's colostrum. Colostrum comes in a very small amounts. Prenatally, 0, not even seeing a drop is normal. After you deliver your baby, typically in the first 24 hours, 3 to 5 mLs. It's like let me show the marble.
Oh yeah, absolutely. There you go.
So 3 to
So
5
what
mLs
is
per
this?
feeding. This would be a stomach size of the baby in the first 24 hours. It's like little marble. I don't know if you can see it, but it's
look,
pretty
right there.
tiny.
Yeah, put it right there so they can see the marble. Right here, look. It will be easier to get it. And for me, it's the best way to show it. Look, I go like this, and I go to the camera and go like.
Okay. Okay, so 3 to 5 mLs after you deliver your baby. If you are hand expressing, that will be a normal amount. So I'll talk about like what I have been seeing lately. I've had patients, multiple patients, who come to the hospital happy to share that they brought 70 mLs of colostrum.
Crazy.
And what happens when they bring 70 mLs of colostrum, we keep that in a freezer until the baby is born. And then once the baby is born, typically we put it in a fridge in a postpartum. So we know that milk is good in the refrigerator for 4 days. And if that patient was in labor for a long time and then they had a baby and it was a C-section delivery, that milk's gonna go bad if it's not being used, if it was defrosted in a fridge and it's not in a freezer. So first and foremost, I would keep it in a freezer as long as possible. Second is, what would you think it will happen if the first day baby is very sleepy and that family decides to feed this baby all the 70 cc's in the first 24 hours?
Well, if they do that, baby is not going to be interested in eating at all. And
So-
baby is not going to practice how to latch.
Exactly. So that's what it's been happening. The patients are confused. There is a process gap. Recognize that patients are confused. Staff is also confused. So when do we use it? How do we use it? How do we feed it? And when to feed it? And so, and especially if that patient already collected 70 cc's of colostrum, there is a high chance that she will probably have oversupply to begin with if she's already making so much. And establishing breastfeeding is important. And in this particular one of the cases, the patient went home so fast, the baby got 70 cc's and never actually established breastfeeding. And then she went home and called crying like, my baby doesn't want to latch.
Okay, so in a normal process, baby is born. The breast is usually soft during the first 2 to 3 days of baby life. And that gives our babies the opportunity to practice how to latch properly and also to stimulate parent supply.
Yes.
That's the normal process.
Yes. But also, it's an opportunity for the staff to really show mother how to
And
breastfeed.
assess the situation,
yes.
see if the baby is really latching properly, if it's any problem, any issue, help the
yes.
baby, help the
Yes.
mother, everything. But if instead of that, I start feeding that baby the colostrum, then this baby doesn't have the opportunity to practice. They're going home. They don't know. Baby doesn't know how to latch. Mom doesn't know how to position and latch the baby.
Yeah. But also what it creates, if you think about that, is intervention. You're doing intervention. You're actually supplementing your baby. Yes, it is your own milk, but by doing that, you're not stimulating your breast to produce milk. So then you need to start pumping.
Exactly.
And it would be more natural to just feed. And I think the biggest thing that kind of affected me in a way that encouraged me to write this article was, by doing that, what are we doing with so basically baby's gut, when they're born, we know it's sterile, right? So whatever comes first to that gut, it aligns the gut, and that basically protects the baby for the rest of their life, right? So whatever the first touches the gut is super important, and we know that, right? So even if the decision is never to breastfeed, or every drop of that colostrum is a valuable gift. So we know, like, when the patients ask me how long to breastfeed, I would just say any drop is better than nothing. And that's true, because that is a gift that lasts a lifetime. So let's say that you, instead of putting baby to the breast right after that baby is born to get fresh milk or colostrum that comes out of our breast, instead we are pulling the colostrum from the freezer that's frozen. Most of those antibodies and properties get lost are diminished by freezing the milk. So instead of aligning the baby's gut with the fresh milk that comes directly from the breast, we are putting this frozen colostrum. So that's another thing that is like, are we really then playing with nature here?
So basically, if a mother that is healthy, baby is healthy, and she decided to express colostrum antenatally, instead of using that colostrum when there is no need for it, save it for later.
Yes.
And you can slowly start giving it to your
Yeah.
baby at some point,
At some point.
whenever is needed.
I'm still like not sure what to say when they ask me when to give. And I mean, I'm open for discussion like with other colleagues about this, because the parents sometimes ask me, but it's colostrum, it's the best thing for my baby, and only have for a little bit. And also, we don't have actually studies to prove if we are removing colostrum early on, especially in these large amounts, are we changing the composition of the milk that comes afterwards?
We don't know.
We don't know that, okay? And then again, we know the fresh milk is better than any frozen. So even though, yes, the colostrum we only have for the first 2 days, yes, it is beneficial, but not as beneficial as the fresh, directly given milk. So
Always fresh milk will be better than frozen milk.
Yeah.
So whenever fresh milk is available, we use that, and then colostrum.
Yes.
And if we can breastfeed directly, what will be the benefits of doing breastfeeding directly instead of giving the breast milk? Baby is receiving dual protection.
yes,
Right?
yes,
Baby
yes.
is receiving protection from respiratory and the mouth. So the
yes.
bacteria are dual.
Yes.
It's even better.
It's the
Right?
magic of breast milk. Yes. And the other thing is like, so let's say that your baby is born small for gestational age, or you have the gestational diabetes or any kind of a diabetes that possibly will affect your baby after delivery, and the baby's blood sugar is low, and you have that colostrum, and then the doctor then says, okay, we need to supplement. Typically, the protocol in a hospital is feed the baby first at the breast, depending on what that number of blood sugar is, and then top it off with little bit. So that would be a good opportunity to feed if there is medical indication to do it. But again, that starts the intervention. That means that the mother who fed that milk that was expressed from before should also start additionally either hand expressing after breastfeeding, or even starting pumping if she continues to supplement with her own breast
Yeah,
milk.
exactly. The moment that we're giving baby extra
Yes.
supplementation,
Yeah. Even if it's your own.
even if it's your own breast milk, you have to start using the breast pump.
Yeah.
That's it. Baby gets supplement, you need to use the breast pump if you want to have a good stimulation of your milk supply and be able to continue providing baby your own breast milk for as
Yeah,
long as you
yeah.
want, right? And we also talk not only about parents that may have gestational diabetes, but babies with congenital conditions. We know that those babies, as soon as they're born, they may go to NICU. Those will be other candidates.
Yes.
The parents will be good candidates. Of course, before asking the doctor,
Yes.
right? We
Yes.
always need to ask our
And then the other thing
physicians.
is most hospitals nowadays in United States, at least in California, are offering donor breast milk as an option.
Yeah.
So for those mothers who try hand expressing antenatally and they're not able to get that,
was
that's
gonna ask you that.
definitely an option.
Yeah, the
okay?
confidence,
Yes,
right? There is
knowing
a-
that you have that, you have
There is
that,
a big chance that you may
Yes.
not be able to express any milk.
and then you have something else if you
Yes.
don't need. Yeah. Yeah.
So how can expressing antenatally can affect the confidence of the parent? Because sometimes they will get milk maybe prenatally, but they don't get almost nothing the first day of baby life. And they go like, well,
Yeah.
what happened here?
I know. So I've had instances in both cases. One of those things that recently happened, it was somebody who has nursing degree and very well, obviously, like informed. And she was very confused. She said, I have all this 30 mLs of colostrum. I brought it in. The nurse told me last night I should maybe feed it. And something told me like I shouldn't, so I waited for you to come and to ask you. And I was like, yeah, it's good that you kept it because your baby's breastfeeding beautifully. She goes, it was good. I learned how to hand express. That was a valuable skill. So in her mind, it was a good confidence builder that she was able to see it and she learned how to hand express, but she was definitely confused what to do with it. And then again, on the other hand, I had a patient who was like, I tried, they told me to do it. I really don't know why they told me to do it. She was told that it's okay that she antenatally expressed, and she had very minimal risk factors. But she came to the hospital super anxious, doubting her ability to feed her baby because she thought because she couldn't express antenatally that she wouldn't be able to do it after. And then after her baby was born, she was actually able to hand express just fine.
Yeah.
So it can be both.
Very confusing.
Yeah.
Can be very confusing.
So some get a confidence boost, some get opposite.
The other way
reaction.
around.
Yeah.
So this is not mandatory for everybody. Okay, so for thousands of years, women are being breastfeeding their babies without antenatal expression of colostrum or breast milk, and we were absolutely fine. So we want for you to know that the normal process is that baby's born, and we start breastfeeding our baby, and that's how our baby stimulate our milk supply. Okay, is there anything else that you want to add to this topic, Mina, to those parents that are right there looking online, all this information, and it can be very confusing?
Less is better. You don't need a lot of these tools and things to buy and collect and do. I think having an idea of what your feeding journey you imagine to be, but I think we should start to kind of save the art of breastfeeding and less of the things to buy.
Exactly, right? What
Yes.
happened with all these things that we see online that are
Yes.
like pushing?
Yes, it's very commercialized and business-oriented model that is creating this new trends that I think it's definitely
Confusing.
increasing anxiety that it's there to begin with. It's normal to have a little bit of anxiety of something unknown and new, and then if you see there is a product that you're supposed to fill up the vials of little things and you're not able to, then you think something's wrong, or you think I need to buy all this because it's needed, and it's not necessary.
So what can we do, or what a mother can do to avoid this confusion? Right? Come to a prenatal breastfeeding class.
I wish that every woman attends prenatal breastfeeding
Prenatal
classes.
education.
And then also, like, if you have a opportunity to meet with a lactation consultant prenatally, it would be on one-on-one with a partner. It's very valuable. Unfortunately, most of the hospitals nowadays are outsourcing these breastfeeding classes. You remember when we taught the breastfeeding classes, it was such an amazing opportunity to be part of that journey, the beginning of the journey. Yes, they didn't remember everything from our class, but then we see them in a hospital, and then we learn through their experience how can we be better once we teach the next class. And it was always such a rewarding thing.
Very
for
rewarding
me
experience.
as a provider.
And for the parents,
And
I
for the
remember
parents.
the parents, as soon as we entered the room, they go like,
Yes.
I know you teach my class.
Yes,
It's so
and I
nice."
remember this, but then they don't remember. And so Yes, I love that part, and unfortunately, we are losing that.
And
Both
we're
of
not
the-
gonna lose it. We need to work in not losing it. I'm like, Mina is like, I'm a dreamer. I wanna continue giving the prenatal classes in
Yeah.
person. I would love for parents to understand the value
importance of
of
that,
the
yes.
village.
Yes,
So
yes.
we, the lactation consultants, pediatricians, all the specialists, all the caregivers, nurses, the hospital, WIC program, La Leche League, all of us, we are part of your village.
Yes,
And one
yes.
of the biggest problems that we have with lactation is that we are very isolated in
Yes,
these days.
yes, and I think social media is not helping us, the patients and anybody, and even myself. Like, it's very easy to get in a groove of looking at something, and then you follow these people and you start listening to their messages, and it might be convincing, and you think it's the right thing to do, but
I mean, if somebody has thousands of followers, you're going to be like, oh,
Yeah,
she must
yeah,
be
yeah,
telling
she
something
mustn't-
good.
unfortunately,
And that doesn't really necessarily mean,
Yeah.
look at the background.
Yes, I
Wh-
feel
wh-
like
where is
yeah,
all this
we are
information
losing
coming from?
credibility because of some of those social media influencers and things like that. So
during
hopefully
your
there's be some regulation and something. But going to back to basics and
Yes.
attending more live in-person classes and support group and the village and being around other women with their babies and seeing them, I think it's important.
Extremely helpful, right? So my message will be for this pregnant mother that is, or family, pregnant family, expecting their babies. One of your homework for this week will be go to check your local hospital, see if they have lactation consultants on site, or check your pediatrician, if your pediatrician will be more supportive of breastfeeding, if you are interested in that, if they have lactation consultants inside, like our pediatricians at Balboa Pediatrics, and check what is there available for you in your neighborhood. Also remember that nowadays we learned that working online in a good way, we can do video calls.
Yes,
Because there are areas where maybe there are no lactation consultants nearby.
True.
So you can always contact Mina, you can contact me, or many of all the others IBLCs are out there that we are eager to help you learning or in the process of your journey, whatever your journey takes, right? Whatever you prefer. Is there anything else that you want to add, Mina, before we finish today?
No, I think we covered pretty much everything. I would
How people can contact you, how they can find you if they want.
either my website or email.
Okay, so right there, in the screen, you have Mina's website. It's coming in a few minutes, seconds. But I want for you to let you know that Mina offers prenatal and postpartum lactation visits in office, in-home visits in the San Fernando Valley area. She's also a professional mentorship.
Yes,
I love that.
I train future IBCLCs, and few last students were actually my patients who became interested in changing their careers, and now they are.
I think I met Camille, right?
Yes, and then yes.
And are you running any support group
And
at
I
this
do run a
moment?
support group at Tarzana Providence Cedar Sinai Hospital. It's a free resource. I've been doing this for almost 18 years. It's best part of my work, supporting my own community and being part of that. It's every Fridays from 10 to 11:30.
How people can get into the support group? They just show up? They can, or
Unfortunately, not anymore, because I have to control a number of attendings because of the space limitation. But if they go on the hospital website, they can find information, and my contact information is there as well.
excellent. And if you go to the website, and you cannot find it, you can go to her website and email her and make sure that you find that information, because you're gonna love it. I know it's difficult for most of my parents to start coming to the breastfeeding support group.
Yes.
But once that they come,
yes.
it's
And then
like,
meet other moms.
you're like, you
Yes,
are
like-
already done. You graduated from breastfeeding support
yeah.
group. You're ready to go. You're free to fly. But many times they keep coming because they really love the
Yes,
feeling,
yes,
right?
yes.
In my case, if you want to find me, my website is Breast Time of Life. My YouTube channel is Soy Paula. I'm Paula. We're going to be adding a video with this information in Spanish soon. And tomorrow in the Santa Clarita area, I'm going to be having my in-person breastfeeding support group. It's going to
Is it
be
still outside or inside?
it's inside.
Okay,
It's in
okay.
a beautiful place, a beautiful building. So you can find my information right there in my website, Breast Time of Life.
I also love the idea of being outdoor, because I know you did that for a little bit. So.
Yes. As soon as I can do it outdoor again, I will do it. Right now, winter time,
Yeah,
it's a
yeah,
little bit
yeah,
hard.
yeah.
Parents are a little bit afraid of the weather, but it's a beautiful place that we have right now in place, and I will be more than happy to see you there tomorrow at 10 in the morning. So, Mina, thank you so much. It was a
Welcome.
pleasure having you here.
This is good.
Exciting.
It was a new experience for
You
me.
survived.
I survived.
Thank you so much, everybody, and see you again in a week.
Thank you for having me.
Bye.
Bye.